is a very common condition that I see with a lot of women, both in the PCOS realm and even in the non-menopausal, perimenopausal situation. Once you become menopausal, estrogen falls off, and this isn't an issue. But there are a lot of women out there that aren't so much making too much estrogen, although that can be an issue, but they're not making enough progesterone. And the lack of progesterone causes so many issues in terms of cortisol regulation, sleep, your ability to um, keep your moods in check, for lack of a better term. Estrogen can make you excessively moody, very anxious. So people that have overly dominant estrogen can have all kinds of mood swings and issues with that. Whereas once you add in progesterone, it just kind of levels that out. And I see this a lot. I see it a lot in women with PCOS. PCOS women are almost always estrogen dominant, and that's what causes them to have really bad cycles, really heavy bleeding, really irregular cycles, and it's because estrogen is thickening the uterine lining and progesterone thins it. Well, if you don't have enough progesterone, you're constantly dealing with a thickened endometrial lining, which results in heavy bleeding. And women with PCOS, because of the estrogen dominance and lack of progesterone, will commonly have a lot of miscarriages, difficulty getting pregnant because their ovulation is all over the place and they can't implant the or maintain the implantation of the fetus into the placenta, so they spontaneously abort. So commonly I'll see women and they'll have all the signs of PCOS, and I'll ask them, how many miscarriages have you had? And they'll rattle off two, three, four. Sometimes it's kind of staggering. And women with PCOS or estrogen dominance very commonly will have postpartum depression. And that is because once you deliver, your estrogen is soaring into the hundreds, sometimes five, six, seven, 800, and your progesterone has dropped off completely. And so that lack of progesterone causes all of this substantial estrogen dominance, which leads to then postpartum depression. You add in progesterone, and it's like you fix the person with a magic wand. So estrogen dominance is excessively common. And then if you add in an issue with methylation and you have a methylation genomic dysfunction, which can cause you to have elimination problems with estrogen. So you not only do you have too much estrogen that's unopposed, but now you have an inability to eliminate estrogen that can make the person even just that much worse. So those people are like the perfect storm of estrogen dominance, and they need things to help with methylation. They need progesterone. They need a lot of therapy to try to get them balanced out. And a lot of times, these people are on SSRIs. They're on anxiety medication because their doctors just think they're goofy and they're anxious and they have a psychiatric problem. But in reality, it's just the estrogen just going loco. It's just in the six, 700s. So in these patients that have severe estrogen dominance, which again, most people with PCOS have, it's a very real and a very common thing and something that you can do a lot about. So if your cycles are really bad, if you've had multiple miscarriages, if you've had difficulty getting pregnant, if you're now on birth control because your cycles have been so horrendous, it's because you're estrogen dominant and you really don't need birth control, especially up into your 40s and 50s. You just need progesterone. And birth control, this is important, birth control is not going to counteract cortisol like natural progesterone is going to do. And so that lack of cortisol regulation is going to cause a couple of things. It's going to cause you to have irregular sleep, and it's going to have issues with you having insulin spiking and insulin regulation problems because your body isn't making too much cortisol, but it doesn't have a means to manage the cortisol without progesterone. And so that lack of means of managing cortisol causes you to have a constant fight or flight response. You're dumping tons and tons of glycogen from the liver because your body's like, we're in fight or flight, we got to be ready to fight, it's dumping glycogen into the liver, which guess what? Stimulates an insulin response, which then causes weight gain. So people with progesterone deficiency / estrogen dominance almost always have cortisol regulation problems, insulin resistance, weight challenges, and so on. So if this fits your picture, you may want to look a little deeper because that's probably what's going on.